Aloha. Good morning, everyone. Welcome to the Hawaii State Teachers Association news conference revealing that the State Department of Health's school reopening metrics are ignoring some basic metrics from the Federal Centers for Disease Control. Corey Rosenlee, who is HSTA state president, is going to start things off with some brief comments and a brief presentation looking at some of the metrics and some of our concerns, and then he's going to be taking questions from reporters. So without further ado, Corey.
Good morning. I'm Corey Rosenlee, president of the Hawaii State Teachers Association. Tomorrow, the Board of Education is holding a special meeting to deal with certain items, especially telework and the metrics for reopening schools. One of the action items up for discussion is by the Board of Education and the use of the Hawaii Department of Health guidance for schools. The state's guidance, while citing the Federal Centers for Disease Control, does not use the CDC's metrics. Instead, it looks like the numbers to reopen schools were used to justify sending students back to campuses across the state instead of following the CDC's recommendations, and by looking at the research. On the BOE agenda is this one item which I want to quote. It says, the superintendent must request a rationale from the Department of Health on how it determined its learning model parameters, including any scientific data on which it is based, and the explanation of how it aligns with the CDC's indicators for dynamic school decision-making. And the superintendent must include the rationale in the reopening plan for the purposes of transparency and addressing public concerns. The rationale for the metrics is ill-defined and is putting our public school teachers and educators in jeopardy. HSTA appreciates that the Board of Education will be addressing these metrics on Thursday, but we are concerned that the complex area superintendents across the state are already using these metrics to determine whether schools can be reopened or not. On Monday, the two complex area superintendents representing Honolulu sent a letter out to their communities saying that they plan on bringing some students back to campuses in the second quarter. For the Farrington, Kaiser, and Kalani complex, this would include kindergarten at the elementary level, 6th graders at the middle school level, and 12th graders at the high school level. This is in direct contrast to the Kailua and Kalaheo complex area superintendent, where they will be doing distance learning for the second quarter. When the two complex area superintendents sent out their letters, they referenced Superintendent Kishimoto's announcement that the DOE will be using the newly released guidance from the Hawaii Department of Health. So with that, what we'd like to do is to show you the vast difference between what the CDC is recommending and what the Hawaii Department of Health put out, and why this is dangerous to both our teachers and our students. So with that, I'd like to go to the first slide. Okay, so with the first slide, in its guidance, the CDC uses the numbers of new cases per 100,000 individuals over the last 14 days. The DOH uses the numbers of cases per 10,000 individuals over the last 14 days. So for comparison purposes, you can just divide the CDC numbers by 10. Now with that, as you can see, the first row, which would allow all students as you can see, the first row, which would allow all students into schools, the DOH is willing to allow 10 times as many cases in the community as the CDC numbers. In fact, if you look at the numbers, the CDC would, for its second category, would allow 6 to 15 for in-person and blended for secondary, which the CDC would only have 0.5 to less than 2. In fact, the first 3 categories for the CDC are all only in the Department of Health's first category for in-person learning. You can similarly see in the subsequent rows where the Department of Health allows more than 7 times as many cases in the community than the CDC. The CDC's recommendations to keep everyone learning from home on the bottom row in red are 2 levels up in yellow for the Department of Health. Now, we want to show what the implications of these metrics would be on Oahu. That's the next slide. The Department of Health has listed Oahu as having 19.9 cases per 10,000. According to the Department of Health, that allows for blended learning for all students, which allows CASs to bring students back on campuses. If we use the CDC numbers, it would be much more safer and more limited. It'd be blended for elementary students and learn for home for all secondary students. But it is only 0.1 case away from distance learning for all students. And this 0.1 case matters, this 1 case matters, because it's dependent on accurate testing, contact tracing, and enough tests, all which have lagged in Hawaii. The teachers in Hawaii have also expressed their concern that the constant vacillation between distance learning, hybrid learning, has made it both difficult for teachers and students, and that we cannot be going back and forth between each ones. So that's why when the DOH's announcement was coming out, by using the CDC numbers, we want consistency. This goes to the next slide. One of the things that is clearly not present in the Hawaii Department of Health standards is the other metrics that the CDC uses. The CDC looks at many other metrics before they decide whether schools are safe to reopen. Things such as inpatient beds and intensive care hospital beds. But one of the things they also look at is the daily new cases. On the day that it was announced, these new school metrics, Hawaii had 10.4 cases per 100,000, which would have put Oahu at the highest level and would require distance learning for all students. Why did the health department fail to include these critical metrics that the state and schools, let me say that again. Why did the health department fail to include these other crucial metrics that other states and school districts are using? It appears that the state was going for the bare minimum so they could use to justify reopening schools in spite of the continued dangers from community spread. Finally, the last slide. We wanted to look at what was going on across the entire state and how that would impact each of the islands. And for the last slide, what it shows is if you used the Department of Health standards of 0 to 5, Lanai, Kauai, and Maui would be able to do in-person learning for elementary and secondary, would be able to do in-person learning for elementary and blended for Molokai and Hawaii for in-person for Molokai and Hawaii for elementary, and blended for secondary for Molokai and Hawaii. And would be blended for Oahu for elementary and secondary. But for the CDC numbers, the 9 Kauai could be in person, but then it jumps all the way up for Maui, which would be in blended, and Oahu, Molokai, and Hawaii would be blended for elementary and would be distance learning from home for secondary. And again, Oahu only that 0.1 away. Now, with that, there's other things that are very important to take into note. First of all, just a while back, it seemed like Molokai would be easy for schools to reopen, and some of their good schools did reopen for all students. And quickly, we saw a rise of cases there. Now Molokai is in the second highest category using the CDC numbers. In Lanai, one of the things that was deep concern is the concern that if any cases happen there, the school did not have enough substitutes for cover for teachers, and they were worried about the long-term impact for all of their students. And even in Kauai, the teachers have shared their concerns that trying to reopen up the resort bubble at the same time of trying to reopen up the schools will lead to a lot of cases on Kauai. Now, HSTA does not know how the Department of Health reached their numbers and why they are different from the CDC, and why the Department of Health did not include metrics from the CDC, the other metrics from the CDC. Before students are allowed back in classrooms, the Department of Health has to justify these numbers. And that is one of the things that the Board of Education is asking for as well. And one of the concerns that we have to ask is even the CDC numbers, we have to sometimes be curious about. There was a New York Times article that just came out just this week that shows that the White House was pressuring the CDC in order to get the schools to reopen. The biggest question I know parents and teachers are asking is, when are our schools ready to reopen? And the answer is, we just don't know. A lot of large school districts across the entire United States are still using distance learning. Some of them are planning to open in the next few weeks or few months. And with that, we're going to see whether any school system can open effectively without a rash of new cases. But the students and teachers of Hawaii cannot be guinea pigs in this large experiment. Our guiding principles must be patience and the safety of everyone before we reopen our schools. And we must make sure that before we open our schools, the science and research supports the safety. And with that, I'll take some questions.
Okay, so reporters, just put your name over in the chat and we'll call on you one by one and ask you to unmute yourself and ask away. Okay, first, Daryl Huff from Hawaii News Now. Daryl, go ahead. Unmute yourself and thanks.
Couple of things. So, is this the same presentation you made to Catherine Payne and the BOE? Do you think this explains why she's taken the position she has? And can you explain what it means, what you think she's saying and the board means by what they're doing?
So this information was shared with Chair Payne. We will be sharing it with the Board of Education tomorrow. We do hope that they will take action to justify where the Department of Health came up with these standards. And what was the second part of that question, Daryl?
I guess what I'm asking is, to retranslate my own question back to myself and back to you, is, does the board have the ability to halt this?
They have asked within their action tomorrow, and if it passes tomorrow, that they have to at least justify the rationale. And they can ask why the Department of Health is not using the CDC metrics. HSTA also believes that it's possible within their realm that they adopt the CDC metrics for reopening our schools.
The other thing that is a big part of her concern was the lack of guidance or the lack of process to allow more teachers to be at home and work from home. Can you talk a little bit about that concern and where you are with that?
So HSTA has always held the position that if teachers do not have to be at school, it would be safer for them to be able to telework and be from home. So we appreciate that the Board of Education is actually taking up this policy, and with a few considerations. They're looking at if the teacher can justify that they don't have any students, that they can do the work just as well from home, that their principal approves that they should be allowed to work from home. And that's what we should, what we've held to as HSTA, that it's much safer for everyone if they're allowed to work from home.
And what's the DOE's answer to this point about that?
Unfortunately, they've left this up to the complex area superintendents. And so just like the reopening plans, we've seen this hodgepodge of policies across the state, where some schools in some complex areas have allowed teachers to telework, and other complex areas they haven't. And this is the same thing that it comes to the reopening plans, is that some complex areas are going distance learning for the second quarter and some are not. The confusing part is that you have some complex area superintendents on the exact same island making different decisions, and this is putting everyone at risk.
And my last question is, what about teachers who actually want to come back to campus and kids that may need to come to campus because they either cannot do their distance learning or they have special needs? Do you see that being able to continue, that teachers who want to be on campus can be there to help, and that students who need to be brought to campus can be done so safely?
So what we've advocated for in the past is that teachers have the option to telework. Some teachers are choosing to be on campus. And right now, there is allowed for vulnerable students to be on campuses. Unfortunately, some principals have been abusing that definition of vulnerable to mean, for one example, all 7th graders. And we do not feel that is correct, and that's abusing the process. I've heard from parents across the state, and they said that their concern is, their kids are not doing well with distance learning, that it's harder. And no one's arguing that distance learning is the best way to teach our students. But what we've seen with the research is that when school systems try to open, there's an explosion of cases. And that's why we have to be very cautious in this process to make sure that before we open our schools, that there is the research that indicates that our schools can reopen safely and not just shut down all over again. And that's why the CDC numbers are much closer to the reality of what is occurring rather than the Department of Health numbers, which are way outside the norm.
Okay, sorry, that reminds me of one more question. So what you're saying is that, there's two concerns here. One is the sort of scattered and random nature of the decisions that are being made. And the other is for the actual, safety of the staff and the students. Do you think that there is a middle ground anywhere here where you could have, as you say, truly vulnerable students coming on, truly volunteering teachers who want to be on campus? But then would that need, in your mind, some sort of overall management to keep it from becoming scattered all over the place? And I'm just wondering if that's even doable in the time we have left.
So one, we do believe that teachers should have that option. The second question is, we've only had vulnerable students on campus, and we've still had over 100 cases in Hawaii. And that's without bringing tens of thousands of students coming back. We've had one death already on our campuses. And I think that's the metrics that are most important is, can we open up safely? I mean, we're not trying to evade this question. This is a grand experiment across the entire United States to see whether or not schools can open during a pandemic without increasing the number of cases, illnesses, and deaths. And the research is not showing right now that it can be. And that's why HSTA has been encouraging that our entire state right now continues with distance learning. And this will give us more time to look at the research. I think this most current example shows that what happens is if you just try to throw numbers together without rationale, without citation, that those numbers can be dangerous.
Okay, and next we hear from Kristen Concilio from the Honolulu Star Advertiser. Kristen.
Hi. Given the politicization of the CDC, do you even trust those guidelines? And with flu season around the corner and, typically running through March and a potential third wave coming our way, do you think schools should remain closed for the remainder of the school year?
So to the first question, I have deep concerns right now about the CDC's numbers. We know from just what was shared this week by the New York Times that they're getting pressure to reopen up schools. It's sad that we live in this day and age where we have to even have questions about an agency that has always had the highest reputation. But even the CDC numbers, we want to see the research behind it. Using the metrics that the CDC is using, have schools been able to open up effectively? We have, three possible choices here. We have the horrible, which is the Department of Health standards. The CDC standards seem to be better, but again, the Department of Health is not including all metrics. But I think the best one is, with anything, we need to look at models, school districts that have had these metrics that have been able to open up effectively. And that's what I think is really missing, is that research. And to the second question, what we've been advocating for is to take it by quarter. We know that schools are not ready to open right now. And what we want is consistency for teachers and students. Our teachers need time to plan. jumping from hybrid to distance learning only makes it difficult for all of them. And so they need time to plan out what their quarter is going to look like. And so if they have that time, they can plan out. Students have right now, they're, most of them are in distance learning, and that would give them that stability as well. And over that time, if there's research that shows something different, then maybe we can open, and that's what we need to look at.
Thanks, Kristen. Next, Ashley Mizuo from Hawaii Public Radio.
Has there been any indication on the DOE's part when it comes especially to Oahu or, some of the islands with multiple complex areas, if that the quota, the opening metrics that DOE and DOH has provided, if those qualify for like specific areas? So for example, like if maybe like Moanalua had low levels of cases, but like Kaneohe had a high level, would that dictate on Oahu what schools would open and what complex areas would open? Or is it just if Oahu as a general island has that metric level, does that mean that any school on Oahu can open?
So the intent was to allow the complex area superintendents is to look at what's happening in the neighborhoods to make that decision. But what we've seen is that is not occurring. If you can look at the example of the two Honolulu complex area superintendents trying to reopen their schools to students, the Farrington complex already has a rash of cases. And that's where we've seen that at Dole, and that was where that death was also. So, it doesn't seem like that's being implemented. The other thing is that teachers don't necessarily live in one community. They live across the entire state and they commute to work. And that also applies to students too. Students have exemptions where they can then go from one district to another district. So just because you have an area, a lower amount of cases doesn't mean that that's not going to spread.
And then I also, when it comes to the notification time of when teachers find out whether or not they'll be going back, is there any minimum number of days before that they need to be notified that they'll be returning to school, or can it just happen, like a few days before?
I'm not aware of it, and it's been hodgepodge across the state of what teachers are finding out. And that's what we're asking the Board of Education to do. There needs to be a consistent policy across the state. And right now, leaving up to the complex area superintendents and the principals is a mess. We've already seen the disastrous results around telework. But when it comes to reopening schools, this is not something that we just mess around with. We need to have clear standards that we can measure and look at to see for effectiveness. And I'll tell you, right now, there's so much inconsistency across the state. I'll tell you, our teachers are frustrated. The hated word is pivot, because they're constantly asked to change things, and this is making it very difficult. So there needs to be consistent standards across the state, which teachers and students can follow.
And then I have one more, sorry. When it comes to the PPE being supplied to, and cleaning supplies and all of those things that DOE has in there that they said would need to be provided to start school again, do you guys have any update from teachers on whether or not they've received those materials and all that sanitation supplies, or that infrastructure that they were going to build has been built in the schools?
So teachers have complained that they still do not have enough equipment. They're also complaining that common areas are not being cleaned. They're concerned about the amount of people that have to share one restroom. And it's not to say anything bad about our custodians across the state, but they're just not equipped to handle the amount of new work that is going out. And that's another one of our concerns is, we have limited people on campus, and there's still a concern of cleanliness and health. We cannot imagine putting more people on campus and seeing what would happen. I mean, anyone has to look at a normal situation of a bathroom on campus and how difficult it is to keep it clean when you have that many people at school.
That's it for me. Thanks.
Thanks, Ashley. Any other reporters have any questions for us? Please put your name over in the chat. If not, I'd like to remind folks listening that this entire news conference is going to be archived on HSTA's Facebook page as well as our YouTube channel, so you can share it with people and review it anytime. And Corey, throw it over to you for some final closing thoughts.
So thank you. So HSTA is advocating that for the second quarter, that all of our students across the state go to distance learning. I appreciate all the teachers that are watching this. I know how difficult it is for them and how difficult it is for our community. And we empathize with all the parents and students that really want to be in school again. But the most important thing when we're doing this is the health and safety of our keiki, our teachers, and our staff. And that must be the priority in all of our decision making. So tomorrow, we'll be watching the Board of Education, and we hope that the Board of Education will make decisions on these matters. Thank you.